All right, this is a technique that I use for the cervical spine. The reason that we address the cervical spine in relation to jaw pain or TMJ pain is because the position of the cervical spine affects the position of the TMJ joint. It's called the cranial-mandibular relationship. And Dr. Ragabato is actually a physical therapist, a physiotherapist in Chile that works in a dental school, and he actually provided radiological evidence that the position of your neck affects the position of your TMJ. So going from there, I'm going to talk about kind of the typical patient that I'll see. Typically, the patients that I see are forward head in nature, so all the way up here. What that does is put the cervical spine, the lower cervical spine in flexion, and the upper cervical spine is extension. So it's kind of like that, to be accentuated. What that does when you have forward head, it actually places the mandible and the TMJ joint in a relative retruded state. So what that can cause is pain, dysfunction, altered EMG activity of the muscles, all sorts of things. So what I want to do is I want to pretty much do the complete opposite of a forward head position. Go ahead and scoot up this way for me. I'm going to scoop my hand underneath his neck, lift his neck up. I'm going to give him a little bit of distraction in his cervical spine, pulling here. And then I'm going to introduce, it's called cervical retraction or a chin tuck exercise. So I pull here, and then I just use my shoulder, and I push down and relax. And I push down and I relax. That's a simple technique that I do that's very effective for any neck pain and related jaw pain. So what that does is when I push down, the lower cervical spine goes into a relative extended position. The upper cervical spine becomes flexed. So that's the exact opposite of being here. And usually what I find is patients will have some sort of a throaty feeling. They'll feel a stretch of their suboccipitals, the base of their skull. They might feel a little strain in the rest of their neck because they're not used to being there. And again, this technique is a little pull. And I come in here with my shoulder and at their chin, their mandible, and push here. If they're very irritated, they have lots of pain, I don't do this part. I just throw my shoulder in here, give a little distraction, and then I push down. And it usually feels pretty good. Push down. And push down. And that's it.